Thank you. Good afternoon, everyone. Thank you for inviting me to present today. It's a great pleasure to be here amongst such esteemed company. So for those of you that aren't familiar, academic health science networks were established in 2013, and the aim of the academic health science networks was to spread innovation at pace and scale, to generate economic growth, and also to improve health outcomes. There are 15 AHSNs nationally, and each AHSN connects the NHS with local authorities, industry, academic institutions, and the voluntary sector. So AF stroke prevention was identified as the AHSN network's first national collaborative programme. Our overarching aim was to drive improvements in AF diagnosis and management, and we had three specific objectives. Firstly, to increase the detection of AF. Secondly, to increase the uptake of anticoagulation therapy in patients at high risk of AF-related stroke. And thirdly, to optimise anticoagulation therapy and also the anticoagulation pathways. So to give you an idea of the scale of the challenge in the East Midlands, in March 2017, Public Health England estimated that there were more than 120,000 people in the East Midlands with AF, of which there were more than 28,000 undiagnosed. And from a treatment perspective, there were over 10,000 people at high risk of AF-related stroke who were not receiving anticoagulation therapy. So what did we do about that? To achieve significant and sustained improvement in AF diagnosis and management, we developed a multifaceted programme of activity. So firstly, we identified clinical and managerial ambassadors in every GP practice and every CCG. The idea being that it was those ambassadors that would drive improvement at local level. Ambassadors were all equipped with a very comprehensive AF toolkit to facilitate engagement across their own practices, but also to raise the profile of the initiative across local populations. And as part of that toolkit, we had some evidence-based quality improvement tools that we shared with colleagues in general practice and offered support to develop bespoke performance improvement plans. We worked very closely with colleagues from the East Midlands Clinical Network to develop a suite of infographics, and these highlighted variation in AF diagnosis and management at practice and CCG level, and these were great in developing or creating a compelling case for change. We deployed over 850 mobile ECG devices to over 400 general practices across the region, and these were to facilitate and improve accuracy of AF diagnosis. So these devices were not only used in routine GP consultations, they were also used in a more targeted way, for instance, in flu clinics and in NHS health checks. We worked closely with Health Education East Midlands, and led by Dr. Yazza Javid, we delivered a programme of clinical upskilling to improve expertise in diagnosis and management, and the upskilling programme had a particular focus in rhythm recognition and anticoagulation. We worked closely with our commissioners to develop a funding offer to drive initial engagement, but also to support sustainability. So as part of the funding offer, we gave protected time to practice nurses so that they could cascade train practice colleagues in use of the device. And we also offered a fixed contribution to a smartphone or iPad to work to use alongside the screening devices. We worked closely again with our CCGs and our GP colleagues to promote use of an electronic evidence-based AF clinical template, and these were widely integrated into GP systems to support ongoing delivery of best practice care. So whilst we monitored improvements in our programme through routine data collection at practice CCG and regional level, to give a degree of academic credibility, we involved NIHR Clark East Midlands right at the outset, and they actually carried out our programme evaluation, which has subsequently been submitted for publication. So what did we achieve with this multifaceted programme of activity? In relation to AF detection, as a region, we've diagnosed nearly 10,000 additional patients since March 2017. And our anticoagulation rate across the region has also increased significantly, with over 11,000 additional people at high risk of AF-related stroke now receiving anticoagulation. And in terms of clinical and cost efficiencies, this level of improvement equates to the prevention of more than 300 strokes, over 100 deaths, and aggregate health and care savings of more than £6 million per year. There were, of course, some key challenges along the way. So ownership of the programme was often affected by changes in clinical and managerial ambassadors at CCG and practice level. For some CCGs, AF simply wasn't regarded as a current priority. We also had resistance from some clinicians who didn't see the added value of the programme and so were reluctant to promote the initiative locally. And for others, there were challenges around capability and capacity to participate. I do want to finish by saying that we very much believe in the East Midlands that the cornerstone to our success with this programme was our system-wide collaborations with key stakeholders. So from an internal oversight perspective, we established, of course, a regional AF steering group, and this was instrumental in shaping programme delivery. We secured wide representation from CCGs, the East Midlands Clinical Network, Public Health England, Health Education East Midlands, and also right care and voluntary sector partners, so the Stroke Association, British Heart Foundation and the Heart Rhythm Alliance, and each of these partners brought unique insights and contributions to the table. We also were very proactive in securing membership of key forums across the East Midlands, so we secured membership, for example, of the CVD Clinical Network, and also strategic level boards in the ICS and STP geographies. Crucially, in the East Midlands, the AF programme was embraced by EMPO. So EMPO is the East Midlands Partner Organisations, and this is a collective of 9 region-wide organisations that operate within the research and innovation space. And the managing directors or equivalent of those 9 organisations come together periodically to share intelligence, identify emerging challenges, and also to explore opportunities to work together in support of delivery of health and care priorities. And AF was one of those priorities that was fully embraced by those key partners. And from a national AHSN network perspective, just to say that the national team established a nationwide AF community of practice, and that was hugely beneficial in terms of providing a platform for learning and sharing. So just to finish by saying, in terms of our next steps, the focus of our AF strategy now is to sustain and improve performance across the region. We're deploying ECG mobile devices to community pharmacists to increase our detection rates. And we're also introducing virtual clinics, whereby specialist anticoagulation pharmacists are deployed into GP practices to work alongside GPs and practice pharmacists to optimise anticoagulation for patients with AF. And we're also exploring a framework for patient self-testing to ensure that we have appropriate governance, education, training and support for those patients who are monitoring their own responses to anticoagulation therapy.